staff. So could the Minister please let us know what steps he is taking to ensure that schools have increased access to testing and that staff are in a safer working environment during this pandemic?
Sarah State.
Well, Mr. Speaker, we know how important it is to give children the opportunity to be in school. That's why on this side of the House we prioritised school opening. We had over 1.6 million children back into schools before the summer holidays. We opened the door to all of our schools right across the country to welcome children back, and it's great to see that 99% of schools are open. But we continue to take the safety and the security, not just of pupils but staff, incredibly seriously. And that is why, as every stage of the way, that we'll be doing everything to ensure that schools remain a safe environment. Because as the Chief Medical Officer for England, Scotland, Wales and Northern Ireland, and the Children's Commissioner for England has said, actually children are best in school.
Mr. Speaker, my thanks for squeezing me in. Can I say to my right honourable friend, it was absolutely right of the government through the tiered system and lockdown to keep schools open against some of the pressure given to him by some of the unions and various others. But can I just say to him, one of the things that many teachers have complained in my area about is the patchiness of some of the advice and the application of whole school groups, sometimes whole year groups, going down because of their fear about infection. I wonder if my right honourable friend or his schools minister would be prepared to deal again with some of the guidance and also possibly come on an online roundtable with my teachers who are very keen to speak to them.
Well, I can absolutely assure my right honourable friend that the schools minister would love to do that with his teachers and is enthusiastically penning in the date. And he is right to say that there has been some inconsistencies. That's why we worked in terms of setting up their national helpline in order to ensure there's a consistency of advice, and working with schools groups and schools trusts to support them to ensure there is a common approach, because we do know that getting children in schools, getting children having the benefit of education and learning, that is what will give them the best opportunities. That is why it continues to remain our focus.
Thank you very much, Mr. Speaker. Last month, during National Adoption Week, it was announced that over 600 children are still waiting to be placed with their forever family. I know my right honourable friend has since launched a national recruitment campaign, but could he, despite the challenges of COVID, say what progress is being made and what plans he has to ensure that those children be placed with their forever families as quickly as possible?
Secretary of State.
Well, both my right honourable friend and myself share a common passion about the importance of adoption, about how we want to be driving up the rate of adoption right across the country. There have been delays in the court service, which has meant that a number of adoptions have been held up. I'm meeting with my right honourable friend, the Secretary of State for Justice, to see what more we can do to speed up this process, to give children the opportunity to be with a family forever. There is nothing more generous that people can do to open up not just their homes but to their hearts, to ensure that those young people have the opportunities that we all want them to have.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order. Just before I call the Prime Minister, I would like to point out the British Sign Language interpretation of the statement is available to watch on parliamentlive.tv. Just say some of the screens aren't working, so we're just going to have to see how we go. We'll try and just take it a bit easy if need be. So what I'm now going to do is call the Prime Minister to make a statement. Prime Minister Boris Johnson.
Mr. Speaker, thank you very much. And with your permission, I will make a statement on the government's COVID winter plan. For the first time since this wretched virus took hold, we can see a route out of the pandemic. The breakthroughs in treatment, in testing and vaccines mean that the scientific cavalry is now in sight. And we know in our hearts that next year we will succeed. By the spring, these advances should reduce the need for the restrictions we've endured in 2020 and make the whole concept of a COVID lockdown redundant. When that moment comes, it will have been made possible by the sacrifices of millions of people across the UK. I'm acutely conscious that no other peacetime Prime Minister has asked so much of the British people, and just as our country has risen to every previous trial, so it has responded this time, and I am deeply grateful. But the hard truth, Mr. Speaker, is that we're not there yet. First, we must get through winter without the virus spreading out of control and squandering our hard-won gains at exactly the time when the burden on the NHS is always greatest. Our winter plan is designed to carry us safely to spring. In recent weeks, families and businesses in England have once again steadfastly observed nationwide restrictions, and they've managed to slow the growth of new cases and ease the worst pressures on our NHS. I can therefore confirm the national restrictions in England will end on the 2nd of December, and they will not be renewed. From next Wednesday, people will be able to leave their home for any purpose and meet others in outdoor public spaces subject to the rule of 6. Collective worship, weddings and outdoor sports can resume, and shops, personal care, gyms and the wider leisure sector can reopen. But without sensible precautions, we would risk the virus escalating into a winter or New Year surge. The incidence of the disease is, alas, still widespread in many areas. So we're not going to replace national measures with a free-for-all, the status quo anti-COVID. We're going to go back instead to a regional tiered approach, applying the toughest measures where COVID is most prevalent. And while the previous local tiers did cut the number and cut the R number, they were not quite enough to reduce it below 1. So the scientific advice, I'm afraid, is that as we come out, our tiers need to be made tougher. In particular, in Tier 1, people should work from home wherever possible. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. In Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaways. And I'm very sorry, obviously, for the unavoidable hardship that this will cause for business owners who've already endured so much disruption this year. Mr. Speaker, unlike the previous arrangements, tiers will now be a uniform set of rules. We've also, and that's to say we won't have negotiations on additional measures with each region. It's a uniform set of rules. And we've learnt from experience that there are some things we can do differently. So from the 10 p.m. closing time for hospitality, we're going to change that so that it is last orders at 10 with closing at 11. In tiers 1 and 2, spectator sports and business events will be free to resume inside and outside with capacity limits and social distancing, providing more consistency with indoor performances in theatres and concert halls. We'll also strengthen the enforcement ability of local authorities, including especially trained officers and new powers to close down premises that pose a risk to public health. Later this week, I should say, we will announce which areas will fall into which tier, I hope on Thursday, based on analysis of cases in all age groups, especially the over 60s, also looking at the rate by which cases are rising or falling, the percentage of those tested in a local population who have COVID, and the current and projected pressures on the NHS. I'm sorry to say, we expect that more regions will fall, at least temporarily, into higher levels than before. But by using these tougher tiers and by using rapid turnaround tests on an ever greater scale to drive R below 1 and keep it there, it should be possible for areas to move down the tiering scale to lower levels of restrictions. By maintaining the pressure on the virus, we can also enable people to see more of their family and friends over Christmas. Mr. Speaker, I can't say that Christmas will be normal this year, but in a period of adversity, time spent with loved ones is even more precious for people of all faiths and none. We all want some kind of Christmas. We need it. We certainly feel we deserve it. But what we don't want is to throw caution to the winds and allow the virus to flare up again, forcing us all back into lockdown in January. So to allow families to come together while minimizing the risk, we're working with the devolved administrations on a special time-limited Christmas dispensation, embracing the whole of the United Kingdom and reflecting the ties of kinship across our islands. But this virus obviously is not going to grant a Christmas truce. It doesn't know it's Christmas, Mr. Speaker, and families will need to make a careful judgment about the risk of visiting elderly relatives. We'll be publishing guidance for those who are clinically extremely vulnerable on how to manage the risks in each tier, as well as over Christmas. As we work to suppress the virus with these local tiers, 2 scientific breakthroughs will ultimately make these restrictions obsolete. As soon as a vaccine is approved, we will dispense it as quickly as possible. But given that this can't be done immediately, we will simultaneously use rapid turnaround testing, the lateral flow testing, that gives results within 30 minutes to identify those without symptoms so they can isolate and avoid transmission. We're beginning to deploy these tests in our NHS and in care homes in England, so people will once again be able to hug and hold hands with loved ones instead of waving at them through a window. By the end of the year, this will allow every care home resident to have 2 visitors who can be tested twice a week. Care workers looking after people in their own homes will be offered weekly tests from today. And from next month, weekly tests will also be available to staff in prisons, food manufacturing, and those delivering and administering COVID vaccines. We're also using testing, as the House knows, to help schools and universities stay open, and testing will enable students to know they can go home safely for Christmas, and indeed back from home to university. But there is another way of using these rapid tests. That is to follow the example of Liverpool, where in the last 2.5 weeks, over 200,000 people have taken part in a community testing, contributing to a very substantial fall in infections. So together with NHS Test and Trace and our fantastic armed forces, we will now launch a major community testing programme, offering all local authorities in Tier 3 areas in England a 6-week surge of testing. The system is untried and there are, of course, many unknowns. But if it works, we should be able to offer those who test negative the prospect of fewer restrictions, for example, meeting up in certain places with others who have also tested negative. And those towns and regions which engage in community testing will have a much greater chance of easing the rules, the tiering that they currently endure. Mr. Speaker, we will also use daily testing to ease another restriction that has impinged on many lives. We will seek to end automatic isolation for close contacts of those found positive. Beginning in Liverpool later this week, contacts who are tested every day for a week will only need to isolate if they themselves test positive. If successful, this approach will be extended across the health system next month and to the whole of England from January. And of course, we're working with the devolved administrations to ensure that Wales, Scotland, Northern Ireland also benefit, as they should and will, from these advances in rapid testing. But clearly, the most hopeful advance of all is how vaccines are now edging ever closer to liberating us from the virus, demonstrating emphatically that this is not a pandemic without end. We can take great heart from today's news, which has the makings of a wonderful British scientific achievement. The vaccine, developed with astonishing speed by Oxford University and AstraZeneca, is now one of 3 capable of delivering a period of immunity. We don't yet know when any will be ready and licensed, but we have ordered 100 million doses of the Oxford vaccine and over 350 million in total, more than enough for everyone in the UK, the Crown dependencies, and the overseas territories. And the NHS is preparing a nationwide immunisation programme ready next month, the like of which we've never witnessed. Mr. Speaker, 2020 has been in many ways a tragic year when so many have lost loved ones and faced financial ruin, and this will be still a hard winter. Christmas cannot be normal and there's a long road to spring, but we have turned a corner and the escape route is in sight. We must hold out against the virus until testing and vaccines come to our rescue and reduce the need for restrictions. And everyone can help speed up the arrival of that moment by continuing to follow the rules, getting tested and self-isolating when instructed, remembering hands, face, space, and pulling together for one final push to the spring when we have every reason to hope and believe that the achievements of our scientists will finally lift the shadow of this virus. And Mr. Speaker, I commend this statement to the House.
Can I just say, the Prime Minister, it's a big statement, he ran 3 minutes over, so can I say to the opposition an extra 2 minutes and to the SNP an extra minute? I now call the Leader of the Opposition, Right Honourable Keir Starmer.
Thank you, Mr. Speaker. Can I thank the Prime Minister for advance sight of his statement and for his telephone call earlier today when he set out a summary of the proposal. Let me start with the good news. The tremendous progress on vaccines. Last week, the Shadow Chancellor and I went to the Oxford Vaccine Group at Oxford University. It was inspiring, it is remarkable to see the work that they are doing. And our thanks, and I think of the whole nation, go to all those who've taken part in the vaccine trials and research, and we wish them Godspeed. I also want to make an open offer to the Prime Minister. Labour will provide any support we can in the national effort to deliver the vaccine safely across the country. That's an open offer. Can I also welcome the fact that the Prime Minister is seeking a 4-nation approach on the arrangements over the Christmas period. We'll obviously await details on this and the evidence that supports the steps being taken, but the 4-nation approach is the right approach. Now for the more difficult bit. The vaccine is the light at the end of the tunnel. The question today is how do we get there and protect lives and livelihoods along the way? The Prime Minister proposes a return to the 3-tier system. That's risky because the previous 3-tier system didn't work. Tier 1 areas drifted to Tier 2. Almost all Tier 2 areas ended up in Tier 3, and those in Tier 3 couldn't see a way out, and we ended up in national lockdown. That was the sad reality of the tiered system before, and nobody wants a repeat of that. Now, I accept that the new tiers are different to the old tiers, but many of the questions are the same. They're not trick questions, and I do acknowledge that none of this is easy. But if the Prime Minister is going to carry Parliament and the country on this, they do need answering. Firstly, on the tier system. The Prime Minister touched on this, but which local areas will be in each tier? This is the red-hot question. This is the question everybody's going to be asking over their kitchen table tonight. I had a round table with business leaders this morning, and it's the first question they asked me. The Prime Minister says it will be decided later this week, possibly Thursday. I just can't emphasise how important it is that these decisions are taken very quickly and very clearly so everybody can plan. That's obviously particularly important for the millions who were in restrictions before the national lockdown, because the message to them today seems to be you will almost be certainly be back where you were before the national lockdown, probably in even stricter restrictions. And people need to know that so that they can plan for that. And I really emphasise how important that is for the Prime Minister. Secondly, and the Prime Minister said he wanted uniform rules. Will the tiers simply be imposed region by region, come what may, from the 3rd of December? Or will there be an element of local consultation and negotiation? I understand the uniform rules, but simply to impose it runs the risk of not getting buy-in from local leaders and local communities, which is incredibly important to people complying with the rules. Third, how long does the Prime Minister anticipate each local area will remain in each tier? For those that are going to come out of lockdown and almost certainly go back to more restrictions than they left, that's going to be a very, very pressing question for them. And then fourth, will there be a new economic package to accompany these new tiers? There's huge concern among many businesses about the viability in Tier 3, particularly a strengthened Tier 3. So what new support can they expect? And can I touch again on those who are self-employed, who are outside of the self-employed scheme, the so-called excluded, because they will be hearing a message about the next 3 months in relation to schemes that they are not currently in, and that needs urgently to be addressed. Can I then turn to the public health impact of this approach? Because one of the major reasons that we ended up in a national lockdown was because, in the words of the government's own scientific advisor, SAGE, test, trace and isolate was only having a marginal impact on transmission. It's one of the reasons they suggested a national lockdown, marginal impact on transmission. Now, I know the Prime Minister will talk about increased testing, mass testing, that's welcome, but it's only part of the story, because the other two parts, trace and isolate, are not fit for purpose. SAGE advised and continues to advise that for trace and isolate to be effective, the percentage of contacts traced needs to be about 80%. It's currently nowhere near that level, it's never been near that level, and the figures are not getting any better. The latest figures actually show that every week about 120,000 close contacts, that's people who should be self-isolating, are not being traced by the system. The likelihood of getting the virus under control when 120,000 people who should be self-isolating are moving around their communities is very low. And then only a fraction of people able to self-isolate are doing so when asked to do so. Now, we said to the Prime Minister this needed to be fixed in the period of the national lockdown, and it hasn't been. It's barely mentioned in the Prime Minister's statement today, and many people will be forgiven for thinking that the Prime Minister's given up on trace and isolate and is about to abandon that scheme altogether to reach out for a different scheme, the mass testing. And it's very important that we understand that if we're going into a tiered system, abandoning trace and isolate, or not getting trace and isolate where it is, we are running a major risk. Mr. Speaker, this isn't about knocking those on the front line or knocking those working on track and trace. It's about being grown up about risk. If we're reintroducing a 3-tier system without having fixed trace and isolate, that is a major risk, and we all need to acknowledge it, because it begs the million-dollar question, which is how confident is the Prime Minister that the approach he's proposing today will keep the R rate below 1. Because if it doesn't, the infections will go up, they will go back out of control, and we could well be back in a national lockdown. That is the million-dollar question. Mr. Speaker, Labour has backed the Prime Minister on all the big decisions the government's had to take to protect public health, including the 2 national lockdowns. We've done so because we want there to be a national consensus on difficult issues like this, and because we'll always put public health first. Ideally, I would like to be in a position to do so again. But there are huge gaps in this plan, huge uncertainties and huge risks. We will await the detail. We want the Prime Minister to get this right. He's got a week to do so. Can he start by answering these straightforward questions? Thank you, Mr. Speaker.
Prime Minister.
Yes, Mr. Speaker. Well, I'd like to thank the right honourable gentleman for his qualified welcome of these measures. He says that they are risky. It's not quite clear whether he's supporting them or not. I think they're the right thing for the country. I think they're the right way of getting the virus down. If he wants to go back into another, we'll keep a national lockdown on, I don't think that's the right way forward for this country. We want to get the economy moving as far as we possibly can, keep schools open whilst suppressing the virus. He asked when we'll make the announcement about who goes into which tier. As I said to him earlier on, and I said in my statement just now, that will be announced on Thursday. The reason for the delay, Mr. Speaker, is quite simply that we need to see the data as it comes in, and of course we will work with local authority leaders about which tiers that they need to apply. We'll discuss it with them, but in the end, we have to take some decisions and get on and do it. And I think we saw from the last experience, it was those local authorities, Liverpool springs to mind, that went early, that were very collaborative, where they've been most successful actually in getting the incidence down. And some of the things that we'll look at in deciding which tier is appropriate, Mr. Speaker: case detection rates in all groups, case detection rates in the over 60s, the rate at which the cases are rising or falling, the positivity rate overall, and the pressures on the NHS in the region. Those are the things that we will be looking at, Mr. Speaker, as we make our judgment. And they clearly, in some ways, the tiers have been changed. I mentioned the point about curfews. There are extra possibilities for indoor and outdoor sports, as I said in my statement, and indoor and outdoor events, as I said in my statement. It is right that the balance of the impact of these should continue to be tough. And he once again criticises NHS test and trace. Mr. Speaker, people should bear in mind that this operation has helped indisputably in identifying the areas that have the greatest prevalence of disease. It's helped us to drive down that disease in those areas. It's been of immense value. They're now testing, they have capacity of 500,000 a day. They've tested, NHS Test and Trace has done more than any other country in Europe. And what is so exciting about the new lateral flow testing is that when it comes to isolate, there is the prospect of using lateral flow tests, as I said, to check whether or not you're actually infected or infectious, and thereby to obviate the need for the 14-day quarantine. So science is really beginning to ride to our rescue, Mr. Speaker, and it's in that context, with the combination of a tiering system and lateral flow tests and the gradual rollout in the weeks and months ahead of the vaccine, that we're able to come out of the lockdown next Wednesday and make the progress that we've described. I'm grateful to the right honourable gentleman for such support as he felt able to offer at this stage. I'm aware that his support is one of those things that kind of now you see it, now you don't. But never mind, I'll take it while it seems to be there, at least temporarily, and look forward to further conversations with him next week.
Damien Green.
Thank you, Mr. Speaker. After the tremendous news about testing and the encouraging developments on vaccines, can I welcome the news that the blanket national lockdown is ending? But in the spirit of a wise constituent who told me that if the government imposes stupid rules, we'll all stop obeying the sensible rules as well, can I ask my right honourable friend that the new tiers be imposed at a local level, districts rather than counties or regions, because restrictions which people feel are unfair to their particular community will simply not be respected or obeyed, and this will itself have a damaging effect on our long-term health.
Prime Minister.
My right honourable friend, and indeed the wisdom of his constituent, but I respectfully disagree. The people of this country have been obeying the rules, and it's to an astonishing degree, it's thanks to the heroic effort of the people of this country in following the guidance, in following the recent measures, that we've got the R down in the way that we have, and we've got the incidence down in some of those areas where the disease was really taking off. If you look at the graphs in the northwest in particular, it's now starting to track down across the country, and I have every confidence in the wisdom of the British people to follow sensible guidance and sensible rules. And on his point about local versus regional, alas, the disease is no respecter of borough boundaries, and we have to have some regions in which to constitute the tiers that are sensible and large enough.
Right, let's head up to Scotland with the SNP leader, Ian Blackford. Ian Blackford.
I would like to thank the Prime Minister for advance sight of his statement and for his telephone call earlier today. Mr. Speaker, this morning, people right across these islands woke up to the more encouraging news on the development of vaccines to fight this deadly virus. It is right that we pay tribute to the remarkable efforts of thousands of scientists across the world who've worked at unprecedented speed to produce these vaccines. All those scientists offer us hope that there is a way out of this pandemic based on the primacy of safety for our society. Far too often in the recent past, expertise in science has been questioned or demeaned by right-wing politicians. So let's now ensure that those same politicians never forget it is a commitment and dedication to science that is now coming to our society's rescue. Mr. Speaker, whilst we all welcome that hope on the horizon, there remain for far too many of our citizens who have not received a single penny of support since the beginning of this pandemic. 3 million freelancers, sole traders, and the recently self-employed all remain excluded from any of the economic support established by this Tory government. These include people right across our community: painters, bricklayers, musicians, artists, entrepreneurs and plumbers. Because of the choices made by this Tory government, they now face a Christmas with no help and no support. Mr. Speaker, myself and my party have now been raising this issue since March, 8 months ago. The excluded are not asking for any special treatment, but just looking for some of the same fairness that others have seen. Others have received support. They should also be getting it. Prime Minister, the Chancellor's spending review this Wednesday will take place exactly 1 month from Christmas Day. So I have one very specific question. Will the Prime Minister today guarantee that a package of financial support will finally be put in place for the 3 million people who have been excluded from any economic support? Will there be some pre-Christmas cheer for the 3 million who have been excluded from help so far?
Prime Minister.
Mr. Speaker, and I think I don't know who the right honourable gentleman means in his attack on those who don't encourage investment in science. He certainly can't mean this government, because we've put forward the biggest ever programme of investment in R&D, and indeed are creating a advanced research projects facility that will rival that of, we hope, of the United States. We're investing in pure science and applied science at a scale undreamt of by any previous government. I think rising to £22 billion a year at the end of the spending review period. So I really don't know who he's talking about, but it is not whichever right-wing foes the right honourable gentleman has in view. It cannot be this government. On his point about supporting the self-employed, look, this has been very, very difficult, Mr. Speaker, and we're doing whatever we can to help the self-employed and the excluded. 13.5 billion has gone so far, I think more now, to support the self-employed. Those that, particularly in the artistic, cultural sectors, are beneficiaries of the £1.57 billion investment in the arts and culture. But the best thing for everybody is, there are many things that apply generally, such as the cut on VAT and the bounce back loans of all kinds that are available to and the grants that are available to everybody. But the best thing for everybody in all sectors is to get the economy moving again, to get the virus down and to move forward. And that's the objective of this winter plan.
Mark Harper. Thank you very much, Mr. Speaker. First of all, Prime Minister, can I thank you for agreeing to meet myself and my honourable friend, the member for Wickham, on behalf of the 70 colleagues who wrote to you at the weekend. We look forward to discussing this matter in more detail later. I think many will hold their judgment on this until we know which areas go into which tiers. I think if you go into tier 3, you'll struggle to spot much of a difference from the lockdown. But can I ask the Prime Minister to set out for each of the restrictions which have such an impact on people and businesses, the impact he's expecting it to have on dealing with COVID, but also the non-COVID health impact and, importantly, the impacts on people's livelihoods, so that we know each measure is going to save more lives than it costs?
Prime Minister.
Yes, indeed, Mr. Speaker. We'll be very happy, and I'm delighted to meet my right honourable friend and the honourable member for Wickham, who've written an excellent letter to me. Many of the points I hope that he agrees in that letter were answered in my statement about sport, the curfew, non-essential retail, gyms, personal.
Have you pressed the button, Prime Minister? Prime Minister. Right. I think we're just going to have to stop for a moment so we can have it checked. We're just checking the sound, Prime Minister. We lost your answer. Have you pressed the button by mistake? Muted.
There's nothing wrong now. There's nothing wrong on our end.
It's not our end, Prime Minister. It could well be yours. I wonder if Mr. Hancock would like to take over with the answer. Is one of you going to do it or not? So he's looking at each other. Sorry? We're going to suspend for 3 minutes then. Okay. In order to allow the safe exit, I'm now going to suspend the House for 3 minutes.
Some problem with the sound.
Right, before we get too carried away, until we get the Prime Minister back, and we will continue with the questions, if you could pick up the answer that we lost halfway through, is that all right for the Secretary of State for Health?
Thank you very much, Mr. Speaker. What I'd say to my right honourable friend, in addition to what the Prime Minister said before we lost the audio, is that while the Tier 3 restrictions that have been set out are less stringent than the national lockdown, it is necessary to be able to get the R down under the tiered system to avoid a further national lockdown if the cases still go up. And as we've set out, we have seen some areas of the country see the case rates come down, and now, thankfully, nationally we're seeing the case rates come down. To his final point about the other health and economic impacts, we of course recognise the economic impacts. On the other health impacts, I would simply reiterate what I've said many times before, which is that the health impacts of not locking down and of the spread of the coronavirus going too broad on other health conditions other than coronavirus are also bad, and the best way to protect the health of the nation, both from coronavirus and from all other conditions, is to keep the virus under control.
David.
Thank you, Mr. Speaker. I think it makes the case for investing in broadband. Can I ask the Secretary of State, though, very seriously, from the lack of tests and PPE, the claims about a protective ring around care homes, while people died in horrifying numbers, the government's abject failure to protect care home residents and care staff has been one of the biggest tragedies of this pandemic. So will the Secretary of State guarantee today that no care home in England will be required or pressurised to admit anyone from an NHS hospital who has tested positive for COVID?
Well, Mr. Speaker, we have over the summer put in place a new regime for ensuring that people who have tested positive but need to go to a care home can get the support that they need in a way that protects them and also protects other residents. And that means that nobody leaves hospital without a test, and those who do need to leave hospital with a positive test must be isolated in a CQC-approved isolation facility. And we do, of course, need to support people who've tested positive, and hospital is often not the best place for them, but we need to do that in a way that protects all other residents as well. And at the same time, I'm delighted that we're able to announce today the expansion of the availability of testing for care homes, for domiciliary care workers as well, and also for care home visiting, which I know is hugely welcomed.
Thank you, Mr. Speaker. We've seen huge efforts across Stoke-on-Trent to get COVID rates down, and the City Council have done an excellent job at rolling out testing. Rates are now falling locally, so will my right honourable friend do everything possible to ensure support continues to be given to local health and council services so we do not exit lockdown at the highest tier?
Well, I pay tribute to everybody in Stoke, the Council, the Royal Stoke Hospital and the wider NHS, and the three colleagues in this House who represent Stoke, including my honourable friend, who have worked so hard together to get the high-quality public health messaging out. We can see the cases coming down in Stoke, and as the Prime Minister set out, on Thursday we'll announce decisions taking into account the very latest data on which areas fall into which tiers.
Samuel Wilson.
Thank you, Mr. Speaker. While millions will welcome the fact that they will now be able to shop, worship and associate with friends and family over Christmas, does the Minister not realise how alarming this statement is today? Rather than being grateful for an announcement which allows us to exercise some basic freedoms, should we not be alarmed that the dependence to do the things which normally people would expect in a democracy now rests in the hands of a minister and the state? And will he accept that today's statement will still deny people the right to earn a living, will drive millions into poverty and will still instill fear, and that should indicate that this policy is a wrong track?
Mr. Speaker, the first duty of any government is to keep the citizens of the country that we serve safe. And that is the reason that we take the actions that we do.
Sir Budley.
I hope the Secretary of State won't think me too eccentric, if I say that on a winter's morning, I like to start my day by swimming the Serpentine and then going to Mass. And of course, he's now abolished both those things the last 4 weeks, and more important, abolished them for hundreds of thousands of people. So my question to him is this, that under any tier, or indeed under any future lockdown, we will never return to the abolition of healthy outdoor sports or going to religious services. There's never been a shred of evidence that they cause any problem. By the way, this is the first time in 800 years that people have been prevented from going to church in this country since the country was put under an interdict by a medieval pope. So we do want reassurance on that. And as we're having this conversation, could you give us some more reassurance about Christmas carols? We don't want it to be just a holy night, and we don't want it to be a silent night either.
Mr. Speaker, I very much hope that we won't have another national lockdown at all. It's one of the reasons that we've toughened up the Tier 3 is to ensure that if areas are in Tier 3, we can get the virus coming down as opposed to just flatten at a high rate as we were seeing before. That way, I hope we can prevent the whole country from ever having to see the sorts of restrictions that we had to bring in order to keep people safe.
Let's have a look.
Diolch yn fawr. It has to be said that news of the 3 vaccinations brings us a much-needed dose of hope as we face the winter months. And of course, Wales is especially vulnerable to COVID-19 because of our older population and our higher levels of deprivation. Will the Secretary of State ensure that Wales receives a sufficient allocation of vaccines based on need and not per head of population?
It's absolutely vital that we vaccinate fairly across this country, across the whole of the UK, according to clinical need. That is the agreement that we have reached amongst the 4 nations. It's the principle that I am determined to follow, given that the UK vaccination programme is obviously across the whole United Kingdom. And we've therefore, on that basis, agreed a fair allocation of vaccine so that vaccination can occur at the same speed in all parts of the country according to clinical need.
We're heading to York Outer, or we hope to be, with Julian Sturdy. Julian Sturdy.
Thank you, Mr. Speaker. Given the big sacrifices that York residents have made to get the virus down locally, does the Secretary of State accept how unfair it will feel if the city is kept in high-tier restrictions, even when our COVID rate is considerably lower than when we entered Tier 2 and one of the lowest in our regions? So does the Secretary of State agree that the new restrictions policy has to give people hope that self-discipline and resilience will be rewarded?
Yes, I do think that those values are important and should be rewarded. And I hope that the areas of the country where the case rate has really come down a long way and is coming down fast, I do hope that we will see the fruits of that effort. Having said that, it is absolutely critical that areas that need to go into Tier 3 do go into Tier 3 in order to get the case rate down and in order to protect the population. We'll take these judgments based on public health advice and over the forthcoming days. The reason that we haven't set those details out today is that the more data we have, the better. And we want to give businesses time to plan to be able to reopen, but at the same time we do want to take into account the very latest data. And in York, as in some other parts of the country, the number of cases is coming down, and I welcome that, and I want to see a few more days' data before we can take those final decisions.
Let's head down to Brian with Caroline Lucas. Caroline Lucas.
Thank you, Mr. Speaker. If these tougher tiers are to deliver sustained reductions in transmission, then test, trace, isolate has to work better. So will he learn the lessons from countries where compliance with self-isolation is much higher, pay people more when necessary, offer hotel accommodation if needed, fix the app so that people told to self-isolate via the app can now qualify for support? And will the government stop repeating that they've given 13 billion for the self-employed when 3 million of them have been unfairly deemed to be ineligible? It's not good enough to say that it's too difficult or wait till the economy is moving again. Please, Minister, no ifs, no buts, no excuses. When is he going to give those people some hope?
Okay.
Thank you very much, Mr. Speaker. And the whole country knows that we are going through very difficult times, but I hope that the news, especially on vaccines that we've seen over the past fortnight, taken together, offers some hope about the way we can get out of this. She mentions the test and trace system, as did the right honourable gentleman on the front bench opposite. I'm very glad to say that not only is the testing regime and the opportunities that we have to roll out testing expanding very, very rapidly, and I pay tribute to the team, but the contact tracing is also improving, and I'm really pleased and pay tribute to all those who've been working to make that happen.
Let's head up to Penrith and the border with Dr Neil Hudson. Dr Neil Hudson.
Thank you, Mr. Speaker. Quite rightly, we are keeping young people in full-time education at this time. The outdoor education sector provides an amazing parallel education for children, and there are many centres in Cumbria and across the UK. These centres are ready for COVID-secure programmes where pupils who are in bubbles at school can be safely accommodated. Will my right honourable friend work across government to look at reopening these centres as soon as possible for residential visits so that whole cohorts of young children do not miss out on this vital and life-affirming educational opportunity?
Secretary of State.
My honourable friend makes a very powerful case for a sector that is obviously prevalent in his beautiful constituency. And I look forward to working with him to see what progress we can make.
Let's head to North Down with Stephen Farry. Stephen Farry.
Thank you, Mr. Speaker. I welcome the progress that has been made on a coordinated approach across the 4 countries of the UK around the Christmas season. Given the particular context of Northern Ireland and indeed all the links across the Irish Sea, can the Secretary of State ensure that this planning also includes the Irish Government? And in doing so, can I suggest that the most immediate priority is clarity around travel arrangements, but some care does need to be taken in relation to the precise guidance around household mixing?
Secretary of State.
Well, yes, I'll absolutely take those points on board in the conversations that ministers are having across the devolved nations of the United Kingdom, and the point that he takes about the enormous number of ties that we have, and family ties between the UK and the Republic of Ireland as well. As he knows, the common travel area is there between the UK and the Republic, and so travel to the Republic has never been restricted from the UK side. That's a point of principle and a point of policy, and I know very important for the people of Northern Ireland in particular.
Mr. Speaker, it's welcome news that Ipswich Hospital found out on the 11th of November that they will be receiving £5.2 million for a new molecular laboratory. This will allow the hospital to ramp up rapid testing to almost 3,000 a day by the end of March. We've also heard reports that Suffolk's first site for delivering vaccinations will be ready in 2 weeks' time, with the NHS proposing Gainsborough Sports Centre in Ipswich. Testing and vaccinations are two crucial ways to beat the virus. So does my right honourable friend agree with me that having Ipswich at the forefront of both of these key issues will be a real boost to Ipswich residents?
Mr. Speaker, we put millions of pounds into Ipswich Hospital, and I know that my honourable friend supports Ipswich Hospital very strongly indeed. And I'm glad that across Suffolk and across the whole of the country, we're putting in place now the vaccination hubs that will be there and ready should the regulator sign off a new vaccine. I don't want to intrude on the rigorous independence of the medical regulator, the MHRA, who will make a decision on the safety of these vaccines, but should it be approved, then the NHS will be ready to begin the rollout. And I've set the NHS the challenge of ensuring that they can roll out at the speed at which these vaccines can be manufactured and produced.
Let's go over to the MP for Huddersfield, to Barry Sherman. Barry Sherman.
Thank you, Mr. Speaker. And will the Secretary of State impart to the Prime Minister my question that can I beg him at this late stage to change his mind? This is a national emergency. And his policy announced today will end up with critical and perhaps tragic results for my constituents and for our country. The fact of the matter is that as soon as we go to a tier system, and I represent Huddersfield in Kirklees, which is the classic, average, typical town in Britain, we've worked better and harder than anyone else to get rates down, and we have not been successful. Under a national plan, we have started to get there. We've only got to keep ourselves going under restriction for a few more weeks, and we will have the antidotes. Please, change your mind, Minister. Change your mind, Prime Minister. We must stop deaths occurring that could be avoided.
Well, Mr. Speaker, the tiered system that's been set out by the Prime Minister today is calibrated very carefully, learning all of the lessons from the lockdowns that have been in place and also the previous tiered system, and evidence from around the world and indeed from the devolved nations, to be calibrated to be able to bring infections down, but do so in a way that also protects the other things that matter in life as much as possible. It is necessary that this Tier 3 in particular is tougher than the previous, not least because of the experience of Huddersfield and Kirklees and other places that were in Tier 3 for quite a long time, but saw a flattening rather than a reduction in their rates. That's why we've brought in a tougher Tier 3, but it is nevertheless does allow for the opening of religious settings and of non-essential retail, which I know is so important for many.
David Collins.
Millions of people will be delighted to hear that grassroots sports will return from the 3rd of December. Can the Secretary of State confirm that will be the case in all 3 tiers? And also, with regards to the tiers themselves, will consideration be given for variances across big counties and regions? For example, the conditions in the Thames estuary can seem very different and distant from those on the South Kent coast.
Yes, I'm delighted that outdoor sports are able to reopen. Like the Culture Secretary, I have had significant representations from people who want to do exercise, which of course is good for your health, and I'm glad that we've been able to do that. When it comes to the geography of the application of the tiers, of course we've got to look at the areas in which people live and travel, but at the same time, as we did previously, where it is it's clear that you can go and there's a genuine difference that isn't represented by administrative boundaries, then we will look at that and make a decision on that basis. For instance, in the previous tiers, we split a borough in one example. But nevertheless, you do also have to look at where people live and travel in order to get these decisions right.
Van Jones.
Speaker, thousands of jobs have been lost in the pub and hospitality sector and are going to be lost. The Prime Minister at the beginning of this crisis said that government actions would follow the science. At a recent meeting with the National Health Director, he was clear that there was no science behind the 10 o'clock, soon to be 11 o'clock curfew, and said it was a policy decision. So if there's no science behind this decision, what are the reasons for it?
Well, we have put in enormous amounts of support to support the hospitality sector, but we do also understand the challenges that the measures that were brought in pose. And the reason behind having to have restrictions on hospitality is that in order to protect the ability of people to go to work and in particular protect education, it is important nevertheless to reduce, sadly, the social contact on which this virus thrives. I mean, it is upsetting, it's frustrating, but it is true, and it's clear from the evidence that we've already had that later in the evening and late at night, social distancing declines, and we know that when social distancing declines, so transmission increases.
Liam Fox.
Thank you, Mr. Speaker. Can I ask the Prime Minister, through the medium of my right honourable friend, what progress is being made in getting an integration between these lockdown measures and testing at the country's airports? Shouldn't we be following the example of other successful countries in helping to boost business travel, help the airline industry, help inwards and outward tourism, and get the workers at our airports back to full-time employment? What encouragement can you give those in my own constituency at Bristol International Airport?
Yes, this is really important, and it's another example of how the increased capacity in testing that we've built can help improve lives. I've been working with my right honourable friend, the Transport Secretary, and the airline industry and the airports, including the regional airports, which are so important, to try to get a better regime in place, and my right honourable friend won't have to wait very long to get an answer.
I head up to Scotland with Stuart C. MacDonald. Stuart C. MacDonald.
Thank you, Mr. Speaker. The uplift to universal credit was a welcome one, but people on legacy benefits, the sick and the disabled, have also faced additional costs and hardship because of the pandemic, and many of those costs were incurred simply to follow government advice on shielding or protecting themselves. So how does he justify not applying the same uplift to those people, and can we have this injustice rectified going forward?
Well, many people in those circumstances also are in receipt of universal credit, and we have put in an increase of £1,000 for those in receipt of universal credit. It is a very significant and generous increase, alongside the furlough arrangements, a very, very substantial package of financial support that the IMF has described as one of the most generous in the world.
The 22, Sir Graham Brady.
Thank you, Mr. Speaker. Can I return to the question that was asked by our right honourable friend from Forest of Dean? I think the Secretary of State said that he recognises the damage that's done by these restrictions. Will he go further and publish the government's assessment of what that impact is, both in economic terms and in health terms? And can I also ask him, will he ensure that on Thursday, when it becomes clear which regions are going into which tier, the government publishes the exact criteria which will be used to make that judgment?
Yes, we will publish the statistics that we look at to make exactly the judgments that my right honourable friend refers to. It is not possible to put a specific number on it, though, and the reason that it's not possible is because there are a number of criteria, and you wouldn't, for instance, want to put an area into lockdown, or a higher tier, more accurately, because it triggered numerical criteria if there was a specific reason. For instance, there's been an outbreak at a barracks in the last month, very significant outbreak. It meant that that area looked like it had a huge spike, but it was entirely, literally, confined to barracks. And therefore, an element of judgment is important in making these decisions, but what we will do is publish the data on which these decisions are taken. And you raised the question also about the economic impact assessment, and I'll raise that point with my right honourable friend, the Chancellor.
We're still hoping to reconnect with the Prime Minister at some point, so in the meantime we'll continue with Jonathan Edwards.
Diolch, Mr. Speaker. The news of the successful development of 3 vaccines is to be warmly welcomed because it offers light at the end of the tunnel. But however, he will recognise that distribution will be a huge logistical challenge. What guarantees can he give that the Welsh Government will receive any additional resources it requires to meet the task at hand?
Where there are the rollout, the vaccines programme is a UK programme, and the costs of the rollout, of course, incur Barnett consequentials and will therefore be available across the whole of the UK. We're working closely with the NHS in Wales to make sure that this happens as smoothly as possible, but it will be the most almighty huge logistical effort for everybody involved.
Richard Drax.
Mr. Speaker, as my right honourable friend knows, I do not support lockdowns, tiered or otherwise, but I welcome the move to get these vaccines, and it's very, very good news. As I understand it, the main weapon the government has is test and trace. Can I suggest test and quick result is equally important? When will the government be able to say, or can tell the House, when the whole country can be tested and get a quick result, so when it's negative, we can all get on with our lives?
I hope that the system, so that people can test daily if they've been in close contact, as the Prime Minister has, with somebody who's tested positive, and that be in place instead of having to isolate as a contact. I hope that that will be in place in January, as the Prime Minister set out. We're piloting it from this week, and then we'll roll it out over December, and I hope it'll be available nationwide from January.
Kate Osborne.
Thank you, Mr. Speaker. I'd like to ask the Prime Minister, or even the Chancellor, but can I ask the Secretary of State, with the infection rates still high across the North East, it's looking likely that the region will come out of this national lockdown in a worse position than it went in. When the tier restrictions were last implemented, local leaders had to fight the government for a fair amount of funding for our region. Can the Secretary of State assure us that this time the North will not be left behind again, and in line with their levelling up, promise and ensure that all businesses and people receive the correct level of financial support that they so desperately need?
Well, I'm glad to see that the number of cases in the North East is falling, and that's good news and testament to people right across the North East. Yes, there will be financial support to the councils that are in higher tier areas, alongside, of course, the huge amount of financial support to individuals through furlough and through the increase to universal credit, and, of course, to businesses too.
Caroline Noakes.
Thank you, Mr. Speaker. Physical and mental well-being go hand in hand, and both are under attack from this virus. I welcome my Right Honourable friend's comments so far on outdoor sport, but at this time of year, it's the fitness studios, the Pilates studios, the dance studios that are crucially important to keep people active. What reassurance can he give the House that even in areas where there is a higher tier, every effort will be made to make sure that people can keep active, recognising the enormous efforts the industry has made to put in COVID-secure measures?
I can give my right honourable friend exactly that assurance, and not least as in all tiers, gyms will be able to be open, and I recognise the enormous efforts that most gyms have gone to make sure that they're COVID secure.
Ruth Cadbury.
Thank you, Mr. Speaker. I talked to Hounslow's Director of Public Health this morning, and she was welcoming the opportunity to have lateral flow testing, rapid testing, under her jurisdiction locally. And we both welcome the fact the government has finally recognised that local health and public health professionals are essential to the successful tackling of infection such as COVID. But councils and primary health trusts cannot altogether roll out rapid testing for vulnerable groups and employ, train and enforce, as just announced by the Prime Minister, and roll out the vaccination programme without significant additional resources. Now, the Army's been helping in Liverpool with the rapid testing, but will the government adequately resource local authorities and local health trusts to deliver what's needed?
Thursday.
She's absolutely right to praise local public health officials, and local directors of public health have done an amazing amount of work throughout this crisis, and we work incredibly closely with them right across the country. What I'd say on the resource issue is absolutely, it's very important that further funding will come forward for those areas in the higher restrictions, not least because of the amount of work that we all need to do together.
Let's head to Lincoln with Carl McCartney. Carl McCartney.
As our right honourable friend, the Prime Minister, said earlier, 2020 has been a difficult year. And unfortunately for freelancers and directors of limited companies in Lincoln and across the UK, they've had a particularly arduous year, with many of them yet to receive next to no financial report from the government as yet. Whilst today's announcements are welcome, we are moving in a positive direction, many will still have to wait several months before small businesses can return to some form of normality. So I asked my right honourable friend to urge his very close friend, the Chancellor, to provide grant funding for these individuals and businesses. Local authorities can and will step in to provide this funding on a case-by-case basis. And to finance this, we can seek the repayment of taxpayer funding from the supermarkets who have quite clearly misused taxpayer support that they do not need. Will my right honourable friend back the blue-collar Conservative campaign and right this wrong?
I'd be very happy to look at it myself, and as you say, take it up with my right honourable friend, the Chancellor, who, as he knows, will be at the dispatch box on Wednesday.
Let's head to Barnsley with Dan Jarvis. Dan Jarvis.
Thank you very much, Mr. Speaker. The government has committed to level up the country, and in particular, the north of England. But given the risk that COVID will level us down, can I ask the Secretary of State what assurances he can give that in Wednesday's spending review, the Chancellor will reform the Green Book, replace the Local Growth Fund with a Shared Prosperity Fund, and deliver the investment needed to tackle regional inequalities?
Well, yes, the Treasury has already updated its Green Book, and that is a significant step. And I know that the Chancellor has been discussing this further. The levelling up agenda, Mr. Speaker, is absolutely critical after this pandemic, even more so than it was before. It's the agenda on which everybody on this side of the House was elected with enormous enthusiasm about a year ago, and we look forward to putting that in place with renewed vigour once this pandemic is over.
Thank you, Mr. Speaker. And given how important maintaining fitness levels is in terms of being able to deal with the illness, could the Secretary of State confirm, I heard him say some welcome things about sport, but will people be able to go to indoor swimming pools, for example, and will they be able to play golf?
Yes, Mr. Speaker, golf is back and outdoor sport is absolutely going to be available under all of the tiers, and we'll be publishing all of the details of this and what works in each tier imminently.
Wendy Chamberlain.
Thank you, Mr. Speaker. Now, I welcome the plans in place to test students, enabling them to travel home for Christmas, and I commend the work of St Andrews University in my constituency of North East Fife, who have stepped in to facilitate this. But a gap remains in the new year. We need to ensure students must return to university can do so safely, as well as giving reassurance to the communities in which they're situated. I understand from the COVID winter plan that guidance will follow suit, but on behalf of the Government, can the Secretary of State advise me what engagement is being had with devolved nations about the return and testing of students in January, including discussions around default online teaching?
Yes, it's a really important subject to get right. The use of testing will allow it, make it easier both for students safely to go home and also then students safely to return to university. It's something that I've discussed with my colleagues across the four nations, not least because so many students go to university in different parts of the United Kingdom. And I hope we have a good regime in place for the return of students in the same way that we have a good regime in place for students to be able safely to go home using those new lateral flow tests that we now have available thanks to the huge investment and the work that we did over the summer.
Let's head up to Burton with Kate Griffiths. Kate Griffiths.
Thank you, Mr. Speaker. So many businesses and jobs in my constituency of Burton are based in pubs and in the brewing industry. They're not set up to provide food and without further support will struggle to make it through December. Can I ask the Prime Minister, through my right honourable friend, to ensure that any support provided to wet pubs also includes the wider brewing industry, who will also be seeing a significant decrease in trade?
Yes, of course. Everybody knows that Burton is inescapably linked to high-quality beer, and anybody who's been to Burton knows that fact, and my heart goes out to the hospitality industry who've been hit so hard. Of course, there are the schemes available nationally, including, of course, furlough and the support for businesses. There has been more support for the hospitality, leisure and accommodation businesses, and there will be cash grants for businesses that are closed under the new tiering system to try to support people through what are inevitably very difficult times.
Thank you, Mr. Speaker. While I'm pleased, Mr. Speaker, that the Prime Minister and the Secretary of State have listened to representation by myself and other colleagues about the importance of reopening, for instance, gyms, golf and collective worship, I'm very disappointed that we heard nothing from the Prime Minister about helping those small business people and small businesses in my constituency who've got hardly little or no help whatsoever, be financially excluded, and should look again at that. But my question, Mr. Speaker, is this, is that following a Freedom of Information request through my local CCG, I looked at GP referrals from September this year compared to September 2019. We saw a huge drop
in the number of people referred for instance, cardio, gastric and trauma and orthopaedic. So while we've heard from the government they're going to put extra financial resources into the NHS, can I ask the Secretary of State how is he going to provide the extra staff in terms of doctors, nurses and specialists to get the waiting list down and to meet the surge in referrals?
Yes, I'm glad to say that we're hiring large numbers of people into the NHS. There's over 13,000 more nurses over the last year, for instance. And I'm very grateful to the Chancellor for putting an extra £3 billion into the NHS next year in order to be able to deal with some of the backlogs that were inevitably caused by the virus. Just to answer the first part of his question as well, there will be grants of up to £3,000 per month for businesses forced to close by restrictions in England, and also backdated grants of up to £2,100 per month for businesses in Tier 2 and 3 areas that have suffered from reduced demand, on top of the national schemes. So I want to reassure him that we're doing everything that we can to be able to support businesses in these difficult times.
Rob Butler.
Thank you, Mr. Speaker. Aylesbury was in Tier 1 prior to the second lockdown, and my constituents accepted the jump to national restrictions on the basis of protecting the National Health Service. Can my right honourable friend reassure them that from December the 3rd, any restrictions will be based on truly local needs, backed up with truly local evidence, so they can see for themselves why the action is needed?
Yes, that's right. We publish unprecedented amounts of data, and the data on which these judgments have to be made. I can commit to him that we will look at the precise data, both in Aylesbury, across Buckinghamshire, and of course nationwide, as we make these difficult judgments.
Let's head up to Scotland with Chris Stevens. Chris Stevens.
Thank you, Mr. Speaker. One of the issues that's not stated often enough is to thank the public sector workers who have gone the extra mile during COVID. I'm thinking particularly those processing furlough payments in HMRC and universal credit payments in DWP, and of course, as the Secretary of State will be aware, the heroic efforts of those who work in the National Health Service. So will the Secretary of State thank those public sector workers for everything they're doing, and can he explain to them why this government believes they should be subjected to a 3-year pay freeze, and whether he thinks that's appropriate?
Mr. Speaker, I'd like to pay tribute to all those who've been working on the coronavirus response, and more broadly across the public and private sectors working together to make this happen. There are clear, significant economic consequences of the actions that we've had to take. And as a country, we're going to have to get through those in the same way that as a country, we've pulled together to get through this coronavirus crisis so far. We're not there yet, but we're making significant progress.
Rick Clark.
Thank you very much indeed, Mr. Speaker. The scientists, their teams and all the volunteers deserve our thanks for getting the breakthrough that we've seen in the vaccine, as does the Secretary of State and the government for funding that research and for acting in anticipation to buy 100 million doses of the vaccine. In that spirit, will he speak to the Chancellor over the next couple of days to advance some of the money that the Prime Minister referred to, the record-breaking increase in science funding, to put it in the hands of those other clinical trials that are funded by charitable funds where fundraising income has dropped, so there's no interruption to life-saving research for cancer and other sources, given that we've made that commitment?
My right honourable friend asks a question that tempts me to give an answer ahead of its time, and I look forward, with him no doubt, to hearing what the Chancellor of the Exchequer has to say on Wednesday.
Let's head up to Leeds with Richard Bergen. Richard Bergen.
Thank you, Mr. Speaker. When the Prime Minister announced the end of the first lockdown in late June, the ONS weekly survey estimates around 25,000 people had COVID. But after the government ignored its own scientists' call for immediate action in September, cases skyrocketed. The latest ONS data estimates there's now over 600,000 people with the virus. Cases will soar again if the government just keeps repeating the same old errors, including the failed tier system, which is what it's doing, driven by the pressure of its own right-wing backbench MPs, not by public health needs. Today's measures risk a third wave. Will the government take responsibility for the thousands of deaths and all the pain of bereavements that would cause?
Thank you very much, Mr. Speaker. I suppose the good news is that I can break to the honourable gentleman is that we have been able to study the impact of the different restrictions that we've had to bring in a set within Tier 3 that are calibrated to ensure that we can get the rates coming down, using the mass testing as well, which has been so effective in Liverpool, where the rates have come down by over 2/3. Quite a remarkable effort by everybody in Liverpool. I'll put my tributes to Joe Anderson on the record once more. So we can do this, especially if we all act and pull together.
Felicity Buchan.
London is the engine of this country's economy, and my central London constituency is suffering hard. As of Friday, London had a substantially lower case rate than the English average, coming in at 75 points lower, and my constituency was 125 points lower. Will my right honourable friend assure me that London will come out at the lowest tier possible, given the health circumstances?
I can assure my honourable friend that London will come out at the tier that is necessary and appropriate based on the public health evidence. What matters is, as my honourable friend says, the case rate, also the case rate amongst the over 60s, and the direction of travel in both of those. And then, of course, the percentage of testing positive, because if you put more tests in, you don't want to then punish an area for having a higher number of positives, and the impact on the NHS. And thankfully in London, the NHS has performed remarkably in this second peak and has coped with it, despite the pressures, admirably well.
I'm going to suspend. We think we're going to get the Prime Minister back, but they just need to check the new line. So I'm suspending the House for 5 minutes while they reconnect. Thanks, everybody.
back with us. Bimafulami.
Thank you, Madam Deputy Speaker. Would the Prime Minister agree on the importance of sport and exercise to both mental and physical well-being, and confirm that going forward into the winter, facilities for outdoor sport and for indoor swimming should remain open in all tiers?
Prime Minister.
My honourable friend is absolutely right about the vital importance of sport, and I can tell him that even in my current confinement, I am taking whatever exercise I can, mainly on a treadmill, I'm afraid. But he's totally right, and what we will do is ensure that gyms, leisure centres and swimming pools are open in all tiers, and of course organised sport can resume.
Charlotte Nichols.
Thank you, Madam Deputy Speaker. As chair of the All-Party Parliamentary Group on Pubs, I've been contacted not just by pubs in my constituency of Warrington North, but across the country, dismayed not only by the extension of the substantial meal requirement to Tier 2, but also the agonising wait to find out what tier their premises will be in as we come out of national lockdown. For those who will be allowed to reopen, in order to be able to do so, they need to be getting their orders in now with suppliers. And for those that can't, they will be losing out on one of their most profitable times of the year. Having been absolutely battered by these restrictions, is it not time for a sector deal for pubs which are the heart of our communities and their supply chain?
Prime Minister.
Well, she makes a very important point, and it's appalling that pubs or any businesses have had to face the restrictions that they have. Nobody has wanted to do it. The reason for the delay that she talks about till Thursday is we just need to look at the data and make sure that we're getting it right about which tiers the various regions, areas should be going into. And of course, she's right that we've got to have plans for the whole of our economy to bounce back, and indeed we do. And she'll be hearing from the Chancellor on Wednesday about that. But pubs and other businesses forced to close, don't forget, remain entitled to furlough until March.
Gary Sambrook.
Thank you, Madam Deputy Speaker. In Birmingham, the data suggests that the biggest driver for transmission is household mixing. And so with that in mind, will the Prime Minister give serious consideration to places like Buzz Bingo and Hollywood Bowl in Great Park in Northfield constituency to be able to open in all three tiers, so not just to save jobs and those businesses, but also that family and friends can socialise in a COVID-secure way?
Prime Minister.
My honourable friend is totally right to support bingo halls and bowling alleys in the way that he does. They're going to be open, as he knows, in tiers 1 and 2. Alas, we can't yet do it in tier 3. But as I said to the House, there is the prospect that where communities come together to get tested together, they can thereby drive down the R. And there is a route out for people now, for communities and towns from these restrictions. And that route is not just through the vaccine, but also through mass testing.
Farrell Clark.
Thank you, Madam Deputy Speaker. Prime Minister, schools across Enfield North face a daily avalanche of challenges to stay open before a single class has taken place. They face mounting costs associated with enhanced cleansing regimes, procurements of laptops for virtual learning, and the skyrocketing bills for staff absence and costs of supply teachers as a result of teachers having to self-isolate. What additional funding, financial support is being made available to schools to support them with this additional COVID-related costs?
Prime Minister.
Well, the Honourable Lady is completely right about the heroic achievement of schools and of teachers in keeping going, and the vast majority of schools, 99% or so, are open to the best of my knowledge, and most pupils are getting the education they need. And that's one of the reasons why we've had to put pressure on other sectors like hospitality. We don't want to do it, but it's social justice that means that we have to keep schools open. We put about £1 billion into supporting catch-up funds for schools, and another 96 million now going in for one-on-one tutorials for work to help kids who are in danger of falling behind.
Scott Benton.
Thank you, Madam Deputy Speaker. The government's support packages for cultural venues throughout this pandemic have provided a lifeline for many attractions in my constituency, and I know that the Prime Minister will join me in welcoming the £760,000 grant we received over the weekend to support and renew the Blackpool Tower Ballroom. As soon as our local attractions can reopen, will the Prime Minister join me in the UK's premier resort of Blackpool to reopen the Tower Ballroom and to make sure we can launch a campaign to encourage people to holiday here in the UK next year?
Prime Minister.
Well, Mr. Speaker, like many of us, I've spent happy hours in the Blackpool Tower Ballroom. I know it well, and it would be a fine thing to see Blackpool and open up again as fast as possible. And I just repeat really the answer I gave a moment ago. We can't say yet what the tiering will be, but mass testing does offer a route forward for Blackpool and all its attractions, illuminations included.
Chiomora.
Thank you, Madam Deputy Speaker. And Small Business Saturday is only a couple of days after the lifting of this lockdown, but the fantastic small businesses in Newcastle don't know how or whether they'll be able to trade. Many small business people are excluded from all support for one reason or another, and their losses are mounting. So will the Prime Minister set out the per head economic support he will be providing to local authorities to help small businesses make it through to the promised land of COVID-free vaccines?
Prime Minister.
Well, the local authorities have, I think, been given about 4.6 billion so far to support them through the pandemic and to help them support hard-hit businesses in their constituencies. And that is on top of the investment that we've made in the VAT cuts, the business rate cuts right the way through to next year, altogether about a £200 billion package of support. And the whole point of coming out into the tiers now or next week is to allow small businesses to get going again. You know, it was awful to have the restrictions that we've had. We hope that we'll be able to take them off and keep them off, but clearly that depends on everybody doing their bit.
I hope we have a link to Harrow. Bob Blackman.
Thank you, Madam Deputy Speaker. My right honourable friend, I understand, is going to require London to be in one regional tier. But as of the end of last week, the rate of infection in the worst affected borough was at 372 per 100,000, but in the least affected area at 125 per 100,000. What will drive which tier London goes into? The position in the worst affected area, the middle, or the least affected area?
Minister. Prime Minister.
He'll have to, my friend will have to wait until the announcements by the Health Secretary on Thursday about exactly who goes into which tier. I mean, as my honourable friend knows, the point about London is that although it's very diverse and massive, 650 square miles or so, it is held together by a very dense mass transit system. And although there are fewer people on it right now, the transmission within London means that it's quite difficult to separate one bit of London from another.
And to Scotland, to Kirsten Oswald.
Thank you, Madam Deputy Speaker. Whatever tier of protection, people expect frontline workers to get the support they need to keep themselves and their colleagues safe. In response to a judicial review initiated by the IWGB trade union, the High Court ruled the UK government was wrong in not extending health and safety protections to gig economy workers. So will the Prime Minister ensure this is corrected and that his government does not appeal against this finding?
Minister.
Madam Deputy Speaker, we will study the judgment and take appropriate action to protect workers.
Aaron Bell.
Thank you, Madam Deputy Speaker. Can I thank the Prime Minister for his statement, and can I also join my honourable friend from Stoke South in praising all the staff at the Royal Stoke for the work they've been doing. It's the scientists that are giving us the most hope at the moment, particularly with the vaccines. And I'd ask the Prime Minister to join me in congratulating Cobra Biologics in Newcastle-under-Lyme, who have been part of the Oxford project. And does he agree with me that the fact that the vaccines are so close now is a reason why we should redouble our efforts to observe the guidance and take responsibility with the extra permissions we will get over December?
Prime Minister.
Completely, my honourable friend completely sums up the strategy and the need now just as we can see the light at the end of the tunnel. Now is the moment when it's vital that we concentrate on the road ahead. Don't veer off one way or the other, and do not allow ourselves to throw away the gains that we've made. It will be a tough few months, but the vaccines that he talks about have unquestionably changed the logic, changed massively improved our position. But it's too early, far too early to be complacent about that. But obviously, I thank the company and his constituency profoundly for what they've done.
Daniel Zeichler.
The Prime Minister failed to answer the question from the Leader of the Opposition about the extent to which local areas would be consulted on which tier they would be returned to. And the Secretary of State was fantastically vague about the geography of any such areas. So can the Prime Minister clarify what exactly are the criteria that are going to be used to make these decisions?
Minister.
Well, with great respect to the honourable gentleman, perhaps that was one of the answers I gave that was mysteriously truncated in the course of my giving it, but I think I said pretty clearly that the criteria we'd use to decide who went into which tier would be case detection rates in all groups, case detection rates in the over 60s, the rate at which cases are rising or falling, positivity rates and pressure on the NHS. So those are some of the criteria that we will use.
Sir Desmond Swain.
He loved Big Brother. Madam Deputy Speaker, the last ruler that told us how we may or may not celebrate Christmas was Oliver Cromwell. It didn't end well, did it?
Prime Minister.
Mr. Speaker, my right honourable friend is completely right in his basic instincts, which I share, and his fundamental libertarian yearnings, which I also share. And I love Christmas. I love a big get together. I think the trouble is that the people of this country can see that there is a real risk that if we blow it at Christmas with a big blowout Christmas, then we'll pay for it in the new year. And they want a cautious and balanced approach, and that's what we will deliver for the whole UK.
Can I make a plea to all members to be as brief as the right honourable gentleman for New Forest West, because after 2 hours we're not even halfway through the number of people who are here hoping to ask questions in this statement. And can I just remind people that they're not making speeches, they're asking questions, brief questions, and they shouldn't read them. And I'm quite sure I can rely on the right honourable member for Rhondda. Chris Bryant.
You always say that before you call me, Madam Deputy Speaker. So you've united the House in that plea as well. Can I just make a plea to the Prime Minister? I've asked him about this before this year. We had terrible flooding in the Rhondda. It led to a landslide from a coal tip, which could all too easily have landed on top of people's houses, or, God forbid, as it has elsewhere in the past in Wales. We need £100 million. So far, the Prime Minister has promised one member of this House to passport the money in February. He promised me in June that this was going to be sorted. We've still only seen £2 million of the £100 million we need. Please, 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 just say now we're going to get that money on Wednesday.
Well, Madam Deputy Speaker, this is a matter for the Welsh Labour government in Wales to deal with, but I also understand the fundamental inability of the Welsh Labour government to deal with so many matters that concern the people of Rhondda, and we will do what we can to address the right honourable gentleman's point.
Richard Graham.
Speaker, many will be relieved that collective worship, outdoor sports, gyms, shops and personal care will resume business as usual. But can the Prime Minister tell us when the limits for spectators at spectator sports and business events will be set, because this will affect many self-employed contractors? And most importantly, what does my right honourable friend think of the chances of getting the over 80s and most vulnerable vaccinated before Christmas, so that that great festival can be a lot more stressful for everyone? A lot less stressful for everyone.
Less stressful. Just while the Prime Minister computes what that question actually was, I should point out, and I'm being kind to the honourable gentleman because he is an honourable gentleman, but he's had 2 questions. I'm not allowing any more 2 questions. It's 1 question, not a speech, or we'll be here all day. Of course, some people want to be. Prime Minister.
Yes, I'm interested in the Freudian slip from my honourable friend about Christmas, but the answer is, I'm afraid that it is just too early to say whether we'll get any vaccine before Christmas that we can deploy at scale. We're optimistic, but we can't be confident at this stage.
Now to Edinburgh, to Christine Jardine.
Madam Deputy Speaker, regardless of today's announcement, so many businesses and people in my constituency of Edinburgh West and across this country are still completely excluded and have been for many months from government support. So can the Prime Minister assure us that his government will address the issue of those millions of people who have been excluded?
Prime Minister.
Madam Deputy Speaker, we hope that nobody has been excluded, and there's a massive package of support and Barnett consequentials for Scotland running to many billions. So 13.5 billion for the self-employed alone.
Madam Deputy Speaker, I know that the whole House will want to join with me in sending our condolences and our thoughts to the 2 crew members of the Joanna C that sank at sea this weekend. If I might ask the Prime Minister, with regards to the announcement that he's made today, will he be making the desire to put the level R1 level as a time-specific objective or a permanent one?
Prime Minister.
Well, obviously, and I echo very much his tribute to the sailors lost at sea. And my honourable friend is right to focus on the R. We want to get it down and keep it down, if possible, for good.
Swansea to Geraint Davis.
Madam Deputy Speaker, Wales is already out of its successful circuit breaker. So when England comes out of lockdown into a tiered system, will the Prime Minister ensure that people who live in Tier 2 and Tier 3 are not in a position to travel with non-essential travel out of those regions, into English regions and into Wales, in order to contain the spread of the transmission of the disease?
He should study that. If he looks at the guidance on Tier 2, on travel in Tier 2 and in Tier 3, he'll see it's set out very clearly there that in Tier 2 you should reduce the number of journeys you make to avoid travelling into Tier 3 areas, and in Tier 3 you should avoid travelling out of the area altogether. But there's more detail in the guidance that he might care to study.
Speaker, we welcome the changes today to gyms, God and golf, opening in all tiers. But can the Prime Minister just confirm to me that the hospitality sector, forced to close in Tier 2 and 3 areas, will continue to receive grant support in the future?
Prime Minister.
Yes, indeed, Madam Deputy Speaker. I can tell my honourable friend that local restrictions support grants are still available, £3,000 for every 28 days a business is forced to close.
Thank you, Madam Deputy Speaker. Under the previous tiering system, my constituents in Lancaster and Wyre have been frustrated that although they have infection rates at the bottom of the Lancashire table of infections, they are bound by the rest of the county when it comes to that tiering system. So can the Prime Minister reassure my constituents and businesses who operate in my constituency that district councils will be taken into account and consulted when it comes to deciding which tiers we're going into?
Prime Minister.
I very much sympathise with her constituents in Lancaster, and where I thank them for the efforts that they've gone to help bring the virus down in their area. It's very difficult, as I was saying earlier on, to draw up the boundaries of these regions in a way that is satisfactory. But what I hope is that people will work together to get the test, to kick COVID out and reduce the virus, to drive down the virus, and thereby to hopefully to reduce the restrictions in their area.
Craig Whittaker.
Speaker, can my honourable friend tell us exactly what the criteria will be for moving up and down the tiered system, and how often a review for each area will take place?
Minister.
Yes. Yes, Madam Deputy, the criteria, as I've set out, I think, a couple of times now, and they will be reviewed every 14 days.
Mary Kelly Foy.
Thank you, Madam Deputy Speaker. While the Prime Minister might hope that coronavirus take the day off this Christmas, key workers in prisons, local authorities and emergency services will be working hard to keep vital services running. Despite this, the Chancellor is apparently set to freeze their pay. Will the Prime Minister order the Chancellor to reverse this decision, or do key workers need to set up unproven PPE companies if they want to receive government money?
Minister.
Well, I thank prison workers and all who have done an incredible job in fighting COVID, helping us as a country to fight COVID over the last few months. I do think the public understand the need to keep the pressure down on public spending at the moment. We've had inflation-busting pay rises previously, but as the Chancellor will be setting out, the economic situation is not easy as a result of what this country has been going through. But what we will ensure is that prison workers are amongst the very first to be able to use the lateral flow testing system to help them get the virus down in their line of work.
Harlow to Rob Halfon.
Speaker, I strongly support what the Prime Minister has said today, and he will know that despite the strong financial support of businesses, that in my constituency of Harlow, many businesses have really struggled. So as well as paying tribute to Harlow small businesses, could I just urge him to ensure that he takes into consideration the really tough, sometimes devastating effects on small businesses in future decisions on COVID?
Minister.
Him for what he does to champion small businesses in Harlow. They're the backbone of our economy. The government, that's why the government has done everything we can to keep businesses going. The furlough system, the grants of £3,000 per month for businesses forced to close, backdated grants for businesses in tiers 2 and 3 that have been affected by reduced demand. I mentioned earlier to another honourable member the support for local authorities for business. That's about 1.1 billion out of the 4.6, and he'll have heard me mention many times the reductions in business rates and VAT, which go on until next year, and plenty of schemes for loans and grants to help small business. That investment now will be repaid, I've no doubt, by growth and dynamism next year as those businesses bounce back.
We now go to Bill Esterson.
The Prime Minister said that he plans to extend mass testing. 2,000 military personnel were needed to deliver mass testing in Liverpool, and they weren't able to extend it to the rest of the 5 boroughs in the city region. They're now due to return to other duties. Meanwhile, other public sector workers are flat out on the crisis already. So what's the plan for rolling out mass testing? And wouldn't it be better to concentrate on getting contact tracing right?
Prime Minister.
The advantage of mass testing is that it's instant, and contact tracing by any system takes 24 hours or so to get you the result. Mass testing can tell you whether you're infectious or not within 15 minutes. The Army have done a fantastic job in Liverpool, and they'll continue to be very valuable as we roll it out.
Alan Cairns.
Thank you, Madam Deputy Speaker. The Prime Minister has given a clear policy direction together with the rationale behind the changes about to be introduced. People will be particularly pleased that spectators can return to sporting events. Will my right honourable friend share the scientific evidence and thinking behind this with the Welsh Government in the hope that my constituents can benefit from the same privileges that will be available in England?
Yes. Yes, indeed, Madam Deputy Speaker. We'll share all the relevant scientific evidence with my right honourable friend in the House.
Phil Linden.
Thank you very much, Madam Deputy Speaker. Show people who run our fairs and showgrounds have been adhering to lockdown rules since March, but because they don't have fixed premises, they're not eligible for rates relief or indeed many other aspects of financial support. So will the Prime Minister agree to meet with myself and the Showman's Guild to look at how we can support people who run our fairs and showgrounds?
Hear, hear.
Prime Minister.
Madam Deputy Speaker, you have to forgive me. I think that was a request to meet the honourable gentleman, and I'm very happy to make sure that his request is taken up at the appropriate ministerial level. I think it was about support for those who have suffered during lockdown. I'm more than happy to do what I can to help.
And now we go to Bill Wiggin.
Thank you, Madam Deputy Speaker. I'd like to thank Tom Keith-Roach and AstraZeneca for producing a vaccine that, when fairly compared, is actually 90% effective. And so will my right honourable friend revisit the restrictions he's proposing today if the vaccine is approved in the coming days?
Prime Minister.
Friend, and he's absolutely right to be optimistic about the AstraZeneca vaccine. I think the trouble is that it may not be deployed or indeed deployable in a rapid enough timescale to allow us to dispense with the kind of restraints that we need to employ. The risk is that we would simply see a surge in the virus and a devastating impact on communities before we've got those shots into people's arms.
Twist.
Thank you, Madam Deputy Speaker. My constituents in Blaydon, along with others across the North East, have been working really hard to stop the spread of coronavirus, and our councils have responded magnificently too. But questions still remain about the funding for the more effective local test and trace, additional support for businesses already in Tier 2 or 3 before the shutdown, and funding for the local rollout of the vaccination programme. Will the Prime Minister ensure that funding is now made available urgently to local authorities to meet these costs?
Prime Minister.
Indeed, Madam Deputy Speaker, we will make sure that we support local authorities who will clearly be playing an important role in rolling out the vaccine. As I said, we've already given £4.5 billion, 4.6 billion to support local authorities. They will continue to play a crucial role, as will the NHS, the Army and other bodies.
Davison.
Thank you, Madam Deputy Speaker. I'm incredibly grateful to the Prime Minister for sticking to his word and ending the national lockdown on 2nd of December as promised. But looking ahead to the new tiered system, I've been speaking to hospitality businesses today who very much welcome the changes to the curfew, but just want the Prime Minister's reassurance that additional support packages will remain in place if they are to go into Tier 2 or 3.
Prime Minister.
Yes, I thank my honourable friend. She's entirely right to support the hospitality industry in her community, and of course support product packages will remain in place.
Now we go to Birmingham, to Liam Byrne.
Thank you very much, Madam Deputy Speaker. On Friday, I met with online nurses with Birmingham who said they've never seen so much death on the wards. They've had to bid goodbye to colleagues who have left the hospital in hearses. Many are suffering from PTSD. We owe it to them to play by the rules to save our NHS. But we've got to save livelihoods too. Now, I've read the action plan the Prime Minister's published. There's one mention of the self-employed on page 39, but in the West Midlands, half of the self-employed aren't eligible for the government support scheme. That's 121,000 people. Now, they're not going to be helped by VAT cuts or bounce back loans or the art and culture scheme. What they need is eligibility for the self-employment scheme. So will the Prime Minister bring forward changes to this scheme, or is he hell-bent on starving our entrepreneurs this Christmas?
Prime Minister.
Of course not, Madam Deputy Speaker, and I feel very much for those who are in a difficult position. We've spent 13.5 billion supporting the self-employed so far. I think possibly more by now, and universal credit remains there. The increase in universal credit is also intended to help those in tough times, as well as all the other provision that I've mentioned. But the best thing we can do for all self-employed people is to get our communities, get our country moving again. And I think that this winter package offers the best way forward.
Kruger.
Thank you, Madam Deputy Speaker. A localised tiered approach is definitely the best way forward. And in Wiltshire, we very much look forward to going back into what I hope will be the lowest level of restrictions. But can my right honourable friend commit to publishing very clear indicators so that local leaders know what they need to do in order to exit down the tiers and eventually get out of the restrictions altogether?
Sir.
Thank my honourable friend. He'll have seen or heard, I think, several times now the criteria we're using to decide which tiers people should go into. The inverse is obviously true, and everybody now has several exit routes. So at least one. There's the vaccine. There's obeying the tiering system scrupulously, but there's also the possibility now of mass testing. Get a test. As a community, kick COVID out and reduce the restrictions you face.
Now we go to Vicky Foxcroft.
Thank you, Madam Deputy Speaker. On the 12th of October, I asked the Prime Minister if he would ensure British Sign Language was available at future press conferences. He said, the point is registered but not delivered. 6 weeks since that question, 8 months since the start of the pandemic, still no progress on a sign language interpreter. So I asked the Prime Minister, will he meet with me and others who rely on sign language interpretation to work out a solution so government communication is inclusive of all disabled people?
And I certainly will make sure that her delegation is properly received, and we try to come up with a solution.
Thank you, Madam Deputy Speaker. Prime Minister, you will know more than anyone else in this House that London is a wonderful, diverse city, and many Londoners tonight will be welcoming much of your statement. But we're not a single homogeneous unit. So can I have your reassurance that when considering the tier system, you will look at the regulations, consider London borough by borough, and not treat us all as one unit?
Prime Minister.
Well, Madam Deputy Speaker, alas, the virus is no respecter of borough boundaries, as I understand things, and London is, of course, my honourable friend is totally right in his analysis. The incidence is different in different parts of the city, but there are many things which unite London and encourage transmission across its vast network. And I'm afraid that's still, the most sensible way of dealing with it.
Now we go to Barbara Keeley.
Thank you, Madam Deputy Speaker. People living in care homes need visitors. The plans to test family members so that they can visit are welcome, but there's a big issue with insurance and the need for care homes to have indemnity if they experience a COVID outbreak after visits. Now, care homes are already struggling financially and they should not be left facing ruinous legal fees because they tried to do the right thing and facilitate safe visits. So will the Prime Minister commit to extending the indemnity to care homes, which the NHS already has, plus financial support to help the care sector pay for spiralling insurance premiums?
Prime Minister.
Deputy Speaker, I'll certainly study the suggestion that she makes, but the best way forward is for care homes to take advantage of the testing system that we have in place, not just lateral flow, but PCR testing as well. That's the way that to check that your employees aren't spreading it, and of course to stop employees going from care home to care home, as been pointed out throughout this pandemic. Very often it's not the visitors, it's not the family members who are importing the disease. Alas, I'm afraid sometimes it's the disease moving from care home to care home, and through employees, and we've got to stop that as well.
James Sunderland.
Madam Deputy Speaker, international travel is vital for our recovery, not least in the aviation, hospitality, leisure and business sectors. Could I please ask the Prime Minister if he's given any thought to the utility of having vaccination stamps in passports or an equivalent scheme to get our planes off the ground?
Yeah.
Prime Minister.
Madam Deputy Speaker, I can assure my honourable friend that the Secretary of State for Transport is looking at all such schemes, and I'm sure he'll have heard what my honourable friend has said loud and clear, and he'll be making some announcements very shortly.
Munira Wilson.
Thank you, Madam Deputy Speaker. Today's COVID winter plan confirms a further £7 billion for test and trace, taking the full bill this year to some £22 billion. Could the Prime Minister confirm how much of this additional funding will be going to the highly effective local authority contact tracing teams? How much will be squandered on management consultants and Serco's failed national contact tracing system? And how much will go on further supporting those asked to self-isolate?
Prime Minister.
Well, Madam Deputy Speaker, I can't give her the breakdown of the figures now, but what I can certainly tell her is that actually NHS Test and Trace has been working hand in glove with local authorities from the beginning. And there are, to the best of my knowledge, about 198 local authority testing teams now actively going out there and doing what's necessary. And they're doing a fantastic job.
Edward Timpson.
Thank you much, Madam Deputy Speaker. Dr Andrew Wilson and the Cheshire Clinical Commissioning Group have done a great job maintaining a high standard of care for patients alongside their COVID workload. So can my right honourable friend reassure Dr Alistair Adey at the Tarpley Health Centre that additional support will be made available to GP practices so they can continue to deliver that standard alongside any vaccination programme?
Prime Minister.
Yes, absolutely. The GPs generally, and I thank Dr Andrew Wilson, the Cheshire Clinical Commissioning Group for everything they've done, and Dr Alistair Adey from the Tarpley Health Centre. The GPs will obviously play a crucial role in this vaccination programme, as they do in all vaccination programmes, and they've been backed with £150 million to prepare.
Going to Glasgow to Carol Monaghan.
Thank you, Madam Deputy Speaker. Household mixing is a major vector for COVID. So unless the Prime Minister has negotiated a ceasefire with the virus, the only mixing we should be considering over the next 6 weeks are our Christmas drinks. So does the Prime Minister actually have an exit strategy, or is he content to accept a certain level of risk through household mixing?
Prime Minister.
Speaker, we think that we've been able to get the virus down and to get it down through a tiered system, as she knows, and we're going to continue to do that. The guidance about the number of people you're allowed to mix with is in households is very clear, and it will remain, alas, it will remain very tough, and it will remain tough because that's the way to get through beyond Christmas, through the new year. And the exit strategy is very simple. It's to use these three techniques: tough tiering, mass testing, and the rollout of the vaccine to keep the virus down and to push it down further until such time as we're able to say that all those who are vulnerable have been vaccinated, and we can move forward and go back completely to normal. And there's several colleagues have, as has been pointed out several times already, that terminus, that end date, looks like being Easter. We may be able to do better before Easter, may be able to make considerable improvements before Easter, but we should aim for Easter.
Steve Bryan.
On the 2nd of November, I asked the Prime Minister what he felt we've learnt in the summer, and after the end of the first lockdown, and he said that I think we should have, when people were contacted tested positive, they isolated. And he said, it doesn't look to me as though the numbers or the proportions have been good enough. We need to get these up in the next phase. I wonder if he could update me on that, because yes, the mass testing is critical and the vaccine may well save us, but there is going to be a gap between certainly the first and the last. And I just wonder if he could update me.
Prime Minister.
My honourable friend is absolutely right that that has been a problem. In fact, more people have been self-isolating than I think is sometimes supposed or alleged, and they've done a great thing. We've instituted the payments to help support those who are doing it, means-tested payments. But I think that what will really change it now is the lateral flow tests, which will, we hope, enable you to have a shorter period of quarantine, so you don't have to stick for the full 14 days, but you can get a rapid turnaround test, a lateral flow test, after a much shorter period, and that's what we're aiming for.
Now we go to Margaret Greenwood.
Thank you, Madam Deputy Speaker. The government has failed to make provision for the delivery of remote education to pupils who live in a household where someone is clinically extremely vulnerable. A number of my constituents are suffering extreme anxiety as a result, as they do their very best to keep their families safe, and some are even considering homeschooling, despite the fact their children love their schools. So will the Prime Minister respond to their concerns and make sure that in his new guidance he makes sure no family is put under unnecessary stress in this way?
Minister.
All the parents who are coping with exceptionally difficult circumstances, trying to do their best for their kids when it is very stressful, and they have the difficulties to knowing whether to send them to school or not. It's much better to send them to school if you possibly can. We distributed, I think, hundreds of thousands of laptops to help pupils learn remotely throughout the summer, and we continue to support catch up and top up learning for vulnerable kids, particularly via one-on-one tuition. I want to see every child supported, and that applies, as she rightly says, to the children of families that are facing particular difficulties.
Dr. Ben Spencer.
Thank you, Madam Deputy Speaker. I very warmly welcome the announcement of the end of national lockdown on the 2nd of December. This morning I had discussions with school leaders in Runnymede and Weybridge regarding the challenges they face, and a key message was that our schools are open, but too many pupils are self-isolating at home. Whole year groups being sent home following a case, and self-isolation of teachers and the impact and cost involved was causing huge challenges for delivery of learning. We must minimise the harms from both COVID and the measures used to fight it. And so does my right honourable friend agree that as soon as possible we need to use targeted testing to support teachers, change and improve our approach to contact tracing in schools, to stop whole year groups having to self-isolate following a case, so that our schools can continue to provide the learning and opportunities our children deserve?
Prime Minister.
My honourable friend is absolutely right to raise the importance of testing in schools, testing teachers, and making sure that we don't send whole bubbles home. And that's why schools and universities, along with NHS, hospitals and care homes, are one of the primary settings in what we want, where we want to roll out, and not just PCR testing, but lateral flow testing as well.
This is very grateful to the Prime Minister for giving such full and thorough answers and really listening to what people are saying. But I will forgive him if, in spite of colleagues giving ridiculously long questions, the Prime Minister feels like giving shorter answers.
I'm very happy to do so, Madam Deputy Speaker. I just don't want to shortchange colleagues. Since I was banished by telecommunications from your presence, I don't want people to think I'm trying to nickel and dime you here.
It is much more difficult for the Prime Minister, since he can't feel the atmosphere here in the chamber. So it's better that I explain to him that both his Secretary of State and the Leader of the Opposition look as if they agree with the point that I've just made. Christian Matheson.
Thank you, Madam Deputy Speaker. And of course, the hope that we have been given by our brilliant scientists will be dashed for millions if the Prime Minister pushes ahead with a public sector pay freeze, which of course is not levelling up that's levelling down, and he doesn't want to be accused of saying one thing and doing another. So will he give a very short answer now and rule out the possibility of a public sector pay freeze?
Prime Minister.
Well, I think he should. I think he should wait until the Chancellor's statement on Wednesday.
Paul Holmes.
Madam Deputy Speaker, I welcome the Prime Minister's statement and the clarity that he's given, but there are 4 independent tap shop and breweries in my constituency who have gone through a terrible time with only being allowed to sell takeaways very late in the day. Will the Prime Minister look with the Chancellor at extending business rate relief to these businesses and bespoke new grants to this industry?
I refer the honourable gentleman, my honourable friend, the answer I gave just now.
Andrew Gwynn.
Thank you. I welcome much in the Prime Minister's statement. Thankfully, Greater Manchester is seeing a downward trend in infections in all 10 boroughs, but we will have been in some form of restrictions now for 4 months. Clearer rules and better enforcement are welcome, but I still don't understand the logic of pushing people out of COVID-secure, well-regulated, responsible hospitality businesses into illegal COVID-insecure gatherings to drink. That would be counterproductive, wouldn't it?
Prime Minister.
Yes, Madam Deputy Speaker.
Thank you, Madam Deputy Speaker. Prime Minister, I welcome the change that will allow people in care homes to be visited by 2 members of their family who will be tested twice a week. Can he ensure that care homes promote visiting and that there is a register that really calls out those care homes that do not allow it?
Prime Minister.
Well, I think care homes should follow their own instincts about the well-being of their residents, and they should follow all the procedures that we've set out and make use of lateral flow testing and other types of protection to ensure that people can see their loved ones and hug them. And that's what I think the people of this country want, and I know many families across the country want to see, and that's what this government is providing for.
Dame Diana Johnson.
Madam Deputy Speaker, Hull has had the highest COVID infection rates in the United Kingdom. And 2 weeks ago, Hull was promised 10,000 lateral flow tests, but today they still have not arrived. So when governing during a global pandemic, shouldn't the Prime Minister focus on delivering on the ground what has already been announced, rather than on grand new promises lifted from the Downing Street PR grid?
Prime Minister.
Well, I will take up immediately the point she makes about Hull and try to understand why they haven't got the lateral flow tests that she rightly wants to see.
Ben Bradley.
Deputy Speaker, Nottinghamshire went into Tier 3 just a few days before the national lockdown. It was a very stressful few days for the beauty industry in Nottinghamshire, which was uniquely forced to close, unlike any other Tier 3 area in the country. Given that the premise of this tiered regional system was to have consistent and fair restrictions across each tier across the country, can you assure me that we'll seek to avoid these kind of irregularities under these new restrictions to avoid the upset that was felt by beauticians and make sure this is fair for small businesses?
Prime Minister.
Yes, we will indeed, and as I said in my statement, we'll make sure that there's much more uniformity about the way we do things.
Zara Sultana.
Thank you, Madam Deputy Speaker. Last week, the Health Secretary told Good Morning Britain, and I quote, "We don't have parking charges in English hospitals for NHS staff, and we're not going to for the course of the pandemic." But this isn't true, because they were reintroduced for staff at University Hospital Coventry and Warwickshire in June, as they have elsewhere. I've written to the Prime Minister about this matter, so now I ask him, will he live up to the government's promise of free parking throughout the pandemic for NHS staff in Coventry and across the country?
Prime Minister.
I will look into the matter that the honourable lady raises and get back to it as soon as I can.
Angela Richardson.
Thank you, Madam Deputy Speaker. Does my right honourable friend agree with me that by protecting NHS capacity during this autumn surge in cases, including at the Royal Surrey Hospital in my constituency, and investing £3 billion into reducing wait times, increasing treatments and mental health care, that this government is taking a balanced approach to all health needs?
Prime Minister.
My honourable friend is absolutely right, and it is a balanced approach that we're going to have to continue to follow through to the spring.
Rachel Hopkins.
Deputy Speaker. Luton Airport supports thousands of jobs and also provides an income stream that funds both council services and local charities. Will the Prime Minister outline what plans the government has to introduce fast air passenger testing regime to prevent further job losses, restore consumer confidence and ensure that local voluntary sector survives? Prime Minister.
She raises an excellent point, and I direct her to the answer I gave a few minutes ago about the statement that will shortly be made by my right honourable friend, the Secretary of State for Transport.
Now we go to Clive Efford.
Thank you, Madam Deputy Speaker. Local authorities have stepped up to the mark to tackle COVID in their areas, but facing additional costs of local track and trace whilst losing income from taxes and fees. So can the Prime Minister ensure that and give us an undertaking that local government will be recognised in the current spending review and that there will be extra resources so that they can pay for the extra services that they're required to provide?
Minister.
Thank local government for everything they're doing. I think they're doing an amazing job in incredibly difficult circumstances, and he can be sure that they will be recognised in the spending review.
Can my right honourable friend, the Prime Minister, confirm that decisions over tiering will be based upon local authority areas like Stockport rather than wider combined authority areas like Greater Manchester?
Prime Minister.
I thank my honourable friend. I can confirm that we will be taking decisions about tiering on the basis of the data and a commonsensical division of the areas concerned.
To Scotland, to Marion Fellows.
Thank you, Madam Deputy Speaker. In a recent survey, 95% of disabled people said that their costs had increased even further as a result of the pandemic, with no £20 uplift to their legacy benefits. Will the Prime Minister listen to the Social Security Advisory Committee, the Work and Pension Select Committee, cross-party MPs and peers, and those who signed the Don't Leave Disabled People Behind petition? And please take action to end this injustice.
Minister.
Study the point that she makes, though. Obviously, I'm proud that we've been able to uplift universal credit by £1,000 a year, helping some of the poorest families across the country, and of course helping the disabled as well.
Now we go to Sir David Evanet.
Thank you, Madam Deputy Speaker. Families and businesses in Bexleyheath and Crayford will share my strong support for my right honourable friend's statement and approach today. However, we have a thriving hospitality sector that has particularly suffered this year because of the necessary restrictions to control the spread of coronavirus. While safety remains a top priority, does my right honourable friend agree that the hospitality sector is the backbone of our local town centres, and it's vital we continue to provide them with the support they need to help survive and protect jobs?
Minister.
Indeed, and I've been with my honourable friend to many a fantastic hospitality venue in Bexley, and I seem to remember going with him to one pub where he christened a blue drink the Bexley Breeze Block, I think it was, from memory. And let's hope that we're able to get the hospitality sector going across the country in the way we all want, so that those fantastic businesses can recover strongly in the new year. But we're going to do that by the techniques that I've mentioned: tough tiering, mass testing, and rolling out a vaccine.
And now we go to Carla Lockhart.
Thank you, Madam Deputy Speaker. The Prime Minister will be aware of the positive role that churches play in our society and the importance of that act of public worship for so many. Churches across the UK are now closed, but I note the intention to reopen them soon in England. Does the Prime Minister agree with me that the role of churches as we live with COVID cannot be underestimated or undervalued, and that we should be looking at opening our churches again right across the United Kingdom? But also, does he recognise that as we deal with the legacy of lockdown, churches have a key role to play in supporting what is a broken land and a broken people?
In her I think I might quarrel with their description of a broken land and a broken people, because I think actually the people of this country have shown fantastic resilience. I don't think that they or we are broken. I think that we're going to come back very strongly, but I also think that churches played an enormous part in that, and I'm glad that they're going to be reopening from next week.
Jonathan Gullis.
Madam Deputy Speaker, my right honourable friend will know that while Stoke-on-Trent may be a small city, it is a mighty one, and having removed itself from government attention over rising coronavirus figures twice this year, the city is once again showing its hardy spirit in pushing down case rates during the second wave by 100 per 100,000 cases in the last week. So will my right honourable friend consider the approach made today by Stoke-on-Trent City Council leader, Councillor Abby Brown, in placing Stoke-on-Trent into Tier 2 as we exit this national lockdown?
Prime Minister.
Well, my honourable friend is so right in the way he champions Stoke and the community spirit of people of Stoke, and I can't say which tier they will, alas, will go into. It will depend on all the things that I've discussed, and the figures are not easy, and the incidence of the virus is still high, and we have to face that grim truth, I'm afraid. But the hope is there that with mass testing, and the people of Stoke can do this if they choose. You can drive down the incidence, you can drive down the R, you can find the asymptomatic positives, and you can reduce the virus in your area. And if you can reduce the virus in your areas, Liverpool has done by about 2/3, partly thanks to participation of the people of Liverpool in mass testing, then you've got the prospect of removing those restrictions as well. So get a test to kick COVID out is what I would also say to the people of Stoke, in addition to thanking them, thanking you for all their hard work.
Justin Maddis.
Thank you, Madam Deputy Speaker. Those areas that are placed in Tier 3 will be keen to get any help that they can receive to get themselves out of it. So, with reference to the mass testing in Liverpool, can the Prime Minister tell us how many of the numbers in reductions in infections can be directly attributed to the mass testing scheme there, and actually what level of population buy-in is needed for that system to be effective?
Prime Minister.
It's an incredibly good question. I mean, Liverpool, in the end, I think they're up to 37% or more of their population has now been tested, and a lot of asymptomatic positives have been found. I've got to stress, it's not the only thing. It can make a big difference, but it's probably to be absolutely certain that it's really playing a decisive part in getting the R down. You need a bigger proportion of the population to do it. You need more community buy-in, but that's why we're working with local leaders across the areas that may be going into Tier 3 to help them with that and to get mass testing programs going, not just like Liverpool, but even more ambitious.
Now we go to Dudley, to Marco Longhi.
Thank you, Madam Deputy Speaker. Will my right honourable friend join me in praising all our care workers, our staff at Russell's Hall Hospital in Dudley, but in particular staff at the Barchester Broadway Halls Care Home, who went out of their way to enable residents Stan Plowetsky, aged 94, and Myra Stays, aged 87, to be part of our Armistice Day commemorations at this very difficult time.
Prime Minister.
Well, my honourable friend is absolutely right to pay tribute to the work of those remarkable staff for what they did to allow Remembrance Sunday commemorations to go ahead, allow people to attend them. I thank them personally, and I thank all care home staff for the unbelievable service they have given and are continuing to give.
Brennan.
Thank you, Madam Deputy Speaker. Does he agree there have been very positive discussions with the devolved administrations, including Wales, about a joined-up Christmas? But can he do something about the terminal incontinence of the Chancellor of the Duchy of Lancaster in continuing to leak the details of this discussion, undermining the trust and respect needed for those discussions to succeed?
Prime Minister.
What I can certainly say is that it doesn't help to read about confidential discussions in the papers. I must say a lot of the stuff I've read seems to me to be very wide of the mark. But I'm grateful, obviously, to all the colleagues in the DAs for the cooperation that they're showing in the work we're doing together.
Natalie Elphick.
Thank you, Madam Deputy Speaker. Will the Prime Minister join me in congratulating all those arts venues, like the Astor Theatre in Deal, churches and parish halls who have opened their COVID-secure doors to help others during the pandemic, and encourage such kindness and neighbourly behaviour to continue as we tackle the virus together across the nation?
Prime Minister.
I do indeed congratulate all the arts venues in Deal who have pulled together in the way that she describes, and let's hope that we can get them all fully open as soon as possible, so that they can enjoy the benefits of a new deal for Deal, or an even better deal for Deal that I'm sure my honourable friend is championing.
Philip Sadiq.
My constituents in Hampstead and Kilburn are excited about seeing their families over Christmas, but also nervous about putting their elderly relatives at risk. Would the Prime Minister consider using the expanded testing capacity to allow families to get a COVID test ahead of visiting elderly relatives at Christmas, even if they don't have symptoms?
Prime Minister.
That is certainly one of the use cases that we are considering, whether it's possible to roll that out across the whole country in time for Christmas. That may be difficult, but she'll have heard what we're doing with those types of tests in care homes to allow people to see their loved ones.
Craig Williams.
Thank you, Madam Deputy Speaker. Can I thank the Prime Minister and welcome the return of the local approach, something I hope the devolved administrations, in particularly in Wales, will copy. And can I pay particular tribute to Powys County Council and the track and taste team that have contributed massively both to the local and national effort. What they and my constituents want for Christmas, Prime Minister, is a united approach across the United Kingdom. And to please my own member for Cardiff West, will he, as the Prime Minister for the whole of the United Kingdom, announce that?
Prime Minister.
Well, Mr. Speaker, I can certainly say that we're going to, I hope very much, to have a united approach, and I have no to Christmas, and I think that's what the people of this country want to see. And I repeat that there is much more that unites us than divides us when it comes to these issues that matter so greatly to the hearts of everybody in our country. We're working together, and we'll, I think, come up with a good solution.
Now we go to Oxford, to Leila Moran.
Thank you, Madam Deputy Speaker. As an Oxford MP, may I echo the Prime Minister in congratulating the Oxford Vaccine Group for today's fantastic news? And will he join me in further congratulating them on being shortlisted for the NHS Parliamentary Awards? As chair of the all-party group on coronavirus, we've repeatedly heard in the course of our inquiry from experts and scientists who are concerned that a prospective vaccine, as welcome as it may be, is in of itself not an exit strategy. Will the Prime Minister meet with me and a cross-party delegation of both houses to discuss our forthcoming recommendations so that we can create a COVID-secure UK that includes testing at the borders and locally led test, trace and isolate systems?
And she's entirely right about the vaccine. It's wonderful news, but it's absolutely premature to say that it constitutes on its own an exit strategy. That's why I've insisted throughout this afternoon that it must be accompanied by NHS test, trace and isolate, but also new types of testing, plus the tough tiering that we have had and will have in place when we come out of this lockdown. And the way forward is to make those things work together, make the tiering work in tandem with the testing so that people get a test with a view to reducing the restrictions under which you are living. Get a test and help to kick COVID out. That's the way forward.
And finally, the prize for patience and perseverance to ask question number 100, Jason McCartney.
Thank you, Madam Deputy Speaker. With a case rate of 552 per 100,000 and the 6th highest case rate in England, I think many people expect Kirklees to be in the highest tier when they're announced on Thursday. And of course, that will mean the closure of hospitality, apart from takeaways. This comes at a time of the year when many cafes, bars, pubs and restaurants try to make their profits to see them through the rest of the year. So can I please end this session by asking the Prime Minister just one more time, please will he speak to the Chancellor again about support for the supply chain for hospitality, support for breweries and cider producers, look again at grant funding, and can they please consider once again cancelling business rates for another year to support our hospitality businesses?
Prime Minister.
Well, my honourable friend makes a passionate plea for breweries, for cider producers and others. I know that my right honourable friend, the Chancellor, is going to be listening very keenly to all that. The points he made, particularly about business rates and other measures. We want to support the hospitality industry in Kirklees and across the country.
I thank the Prime Minister and the Secretary of State for answering 100 questions and bringing the House up to date with plans. Thank you. Point of order. Now, first point of order, Matt Weston.
Thank you, Madam Deputy Speaker, for granting me a point of order. Madam Deputy Speaker, if you could help me on this matter, I'd really appreciate it. On the 15th of June, in response to my written question regarding laptop provision for schools, the Minister for School Standards said the Department for Education had ordered over 200,000 laptops for schools on the 19th of April. On the 2nd of July, here in the Chamber, I asked the Secretary of State for Education why documents released by his own department therefore suggested the first order was in fact placed on the 15th of May. The Secretary of State responded, "I will write to the Honourable Gentleman with clarification on that matter." He failed to write to me. I asked the same question to the Secretary of State in the House of Commons on the 1st of September. He said, "I will write to him with reference to that if he will be so gracious as to accept a letter." He failed to do so again. I followed this up with his department on the 2nd of November. They failed to reply. I followed this up again with his department on the 19th of November. I received a holding email, but am yet to receive a substantive response. Will you, Madam Deputy Speaker, please advise me, what steps do I need to take to secure a response from the Secretary of State for Education, given he first promised to write to me almost 5 months ago?
Although the Honourable Gentleman's point is not a point of order for the Chair, because the Chair, of course, does not have responsibility for what ministers say or write or don't say or don't write. Nevertheless, I understand the Honourable Gentleman's purpose in raising his point of order in the Chamber at this moment, and I can say to him, as Mr. Speaker has said on many occasions, that ministers ought to reply to questions and letters from members of Parliament in a timely fashion, and that the saga that he has just described is not acceptable. And although I can't deal with it from the Chair as a point before the Chamber now, I can say that I hope that the matter has been noted by the Treasury bench and hopefully also by the Leader of the House's office, and that the Honourable Gentleman will receive his answer soon. Thank you. Point of order, Chris Bryant.
Madam Deputy Speaker, you were not in the chair last week when I made the longest point of order that has ever been made in the history of points of order, for which I apologise. But at that time, I suggested that the government had tabled its motion on virtual participation in debates and who should be allowed to take part in those at the very last moment and without notifying the opposition. Now, the Leader of the House has written to me to clarify that he had in fact been in touch with the Shadow Leader of the House, and so that channel had been open, and I should have been, so I want to correct the record, I should have been much more precise in saying that the Government Whip's office had not notified the Opposition Whip's office. I do apologise to the House. I just wonder, therefore, Madam Deputy Speaker, whether the process that I have used for correcting the record would also also be available for the Leader of the House, because he said last week that the reason he was tabling his motion in the way that he did was that the government rule was go to work if you can, i.e. physically. Whereas in actual fact, this afternoon, the Prime Minister has made it absolutely clear that even if we're in Tier 1, the rule is work from home if you can.
Well, I note that the honourable gentleman has now made the second longest point of order.
I'm going for a record.
But, I'm quite sure he'll make the third longest before long. But I appreciate the point that the honourable gentleman is making, and it is quite in order since he has realised that something he said in this chamber was factually incorrect, that he should come to the chamber and correct it, and I'm grateful to him for doing so. As to whether the Leader of the House will consider that he is in a similar position is a matter for him and not for me. Thank you. We will now suspend the House for 3 minutes in order to allow the safe exit of honourable members and entrance of honourable members for the next item of business. Order. Order.
Motion. Minister Rachel Maclean to move.
Thank you, Mr Deputy Speaker. I beg to move the Heavy Commercial Vehicles in Kent Amendment Order 2020 number 1. These amendment orders relate to the heavy commercial vehicles in Kent, Order 2019 number 1, and the heavy